Today we will discuss nerves of the lower limb. Our objectives here are to name the principal nerves of the lower limb, describe the compartments that these nerves innervate, and to describe the significance of these muscular compartments. We begin with this complicated looking diagram of all the nerves that supply the lower extremity. And these nerves are derived from the lower portion of the spinal cord. The spinal nerves from L2 to S3 intermingle to provide the peripheral nerves of the lower limb. And a peripheral nerve usually has contributions from more than one spinal nerve. So this chart here lists the major nerves, the nerves that supply muscle compartments. We'll be concerned today mostly with innervation of the muscles, and at sometime in a later course we'll discuss the sensory distribution of these nerves. But if we look at them more or less in order as they descend along the spinal cord, we see the femoral nerve arises from the root levels of L2 to L4, and it supplies mostly anterior thigh. The obturator nerve arises from the same levels, and it supplies medial thigh. The sciatic nerve, a very large nerve, supplies the muscles of the entire posterior thigh, all the muscles of the leg and the feet. And then two other important muscles that cross the hip joint. The superior gluteal nerve supplies the gluteus medius muscle. It arises from L4 and L5. And the inferior gluteal nerve arises from L5 and S1 and supplies the gluteus maximus. This diagram here shows the femoral nerve highlighted, and it supplies the anterior thigh muscles. What we have here on the right is an anatomic section through the mid thigh, and the highlighted muscles there are the anterior muscles supplied by the femoral nerve. And as you recall, this anterior group are the quadriceps femoris muscles, and these are the muscles largely that extend the knee. This is a section at a slightly lower level of the thigh, showing the medial group, the obturator, supplied by the obturator nerve. And you may recall that these medial muscles are the adductors, the muscles that adduct the thigh. This is another section now showing cross-section, showing the posterior group in the thigh, supplied by the sciatic nerve. And these muscles are the hamstrings, which, as you recall, I hope, extend the hip and flex the knee. And we can see how large this nerve is because of the large territory that it supplies. We'll see more of that as we go inferiorly to the leg. So here, just posterior to the knee, then, the sciatic nerve divides into tibial nerve and the common peroneal nerve. I sometimes interchange between fibular and peroneal. These terms are used commonly interchangeably. And the common peroneal or fibular then splits into a deep fibular and superficial fibular. We'll see that shortly. This highlighted section through the calf shows the posterior group of muscles supplied by the tibial nerve. And we're thinking about the major muscles here. We think about the gastrocnemius, medial and lateral gastrocnemius, and the soleus. And as you recall, these are muscles that plantar flex the foot. The superficial a peroneal nerve, supplies the lateral leg, a small compartment, two muscles of fibularis or peroneus longus and brevis, and these muscles evert the foot. And then the deep fibular nerve supplies the anterior leg, and the principal muscle that concerns us here is the tibialis anterior, which, as you recall, dorsiflexes the foot. So here we're going to have a little quiz. Again, these are low pressure questions, and we ask you to think about them a bit. So the first question here is, nerves from the entire spinal cord supply the lower limb. Think about that for a second. If you said false, that's correct. You recall that the lower or inferior part of the spinal cord is responsible for supplying the muscles of the lower limb. A muscular compartment is bounded by connective tissue and is usually innervated by a single peripheral nerve. If you said true, that's good. As we just discussed, these compartments tend to have similar functions: abduction of the hip, extension of the knee, plantar flexion of the ankle. So we can think of compartments as, in some respect, being functional units of movement. And so a muscular compartment is composed of muscles with similar or closely related functions. If you said true, that's good. As we just discussed, these muscles in a single muscular compartment tend to have similar functions. Okay, again, sometimes we simply have to memorize things. And here's an example. The femoral nerve is composed of spinal nerves from L2 to L4, L4 to L5, and L4 to S3. If you said L2 to L4, that's great. If you didn't remember that, this is something to think about reviewing. The sciatic nerve supplies the medial compartment of the thigh, the anterior compartment of the thigh, the posterior compartment of the thigh, and all the compartments of the leg. What do we think about that? If you said the posterior compartment of the thigh and all the compartments of the leg, that's good. You remembered that the sciatic nerve is large, in part because it has a large territory to supply the muscles of the posterior thigh and the entire leg and foot. Thank you.